Hey everyone, and welcome to the Rules of Thumb podcast with Dr. G. I'm your host, Nick Golinvaux, and I write a weekly newsletter on all things musculoskeletal health and longevity. That means fewer aches and pains and a better knowledge of what to actually do when they inevitably rear their ugly head. In this podcast, I will read to you my article of the week so that you can listen to it on the go. If video is more your thing, welcome to those of you watching on my YouTube channel. And as always, the original article with its associated images will be linked in the show notes below. So without further ado, let's get into this week's article titled, Playing the Odds, How to Avoid Most Hand Injuries. The Pareto Principle. 80% of the consequences come from just 20% of the causes. This is what came to mind when one of you recently asked me a great question. Dr. G, what are the 20% of things that I should be aware of to avoid 80% of the hand injuries I might encounter in a typical day? Or in other words, tell me the few mistakes that lead to hand injuries that you see people make over and over again. I'm so glad you asked. Number 1, table saws, circular saws, and miter saws. Probably no surprise here, but these bad boys are finger eaters. Whether it's big lacerations resulting in tendon and nerve injuries, fingertip amputation, or even devastating full finger or hand amputation, I would need more than 10 fingers, and I know that's a brutal pun for this article, to count the number of these injuries I've seen in the last couple months alone, not to mention my career. Look, I get it. There aren't great alternative options to have wood cut for a project other than doing it yourself. Trust me, I've looked. The hourly employee fresh out of high school at the local hardware store is not making precision cuts for you. There are so many projects around the house I'd love to do, but have ultimately, sadly, ended up scrapping because of how many of these injuries I see. And the worst part, more often than not, the patient was using quote-unquote perfect technique. They had all the safety guards on, they were using a push stick, etc. But the reality is, we can't control everything. Whether a momentary distraction, a knot in the grain of wood, or a broken blade, bad things happen and our hands are rarely spared the consequences. I will say, I've seen a few minor injuries from these fancy and sort of expensive electrified blades that stop the instant they detect human skin. And I have no affiliation, but you can see the video in the article. So I would strongly consider this technology if you use these tools, either professionally or recreationally. Number 2 is kitchen injuries. Again, no real surprise here. Hand surgeons and avocado enthusiasts have a long, close history together. While avocados are probably still the primary offender, slippery food plus various stabbing maneuvers to get the pit out, the kitchen in general is rife with dangers for the hands. Peeling carrots, cutting food, using power mixers, food processors, garbage disposals, you get the point. Lots of blades. And if your kitchen is anything like ours, add in the tired children in that 5 to 7 p.m. witching hour, and the whole place is chaos. A perfect environment for a half-second lapse in concentration that has the potential to change your life forever. I'll never forget the pregnant mom of 4 who came to me after trying to cut an orange with a butter knife. She was pushing so hard on the dull knife that when she slipped, it went straight into her ring finger between her wedding and engagement ring, severing both tendons and both nerves. An absolutely devastating injury that kept her from holding her children in that hand for 4 months. Or the busy dad of 3 who was rushing to take out the recycling, so he pushed down on the recycling to compact the contents, only to realize the sharp lid of the tomato can had gone clear through his finger. Another absolutely life-changing split second. These things happen fast, and sharp objects are everywhere in the kitchen. And those sharp things have a knack of finding the most important functional part of your hand, the palm and the palm side of the fingers, where almost all knife slips go. Keep your wits about you, engage others to tone down the chaos, and keep your hand safe. Number 3 is walking plus dog plus ice. If you asked me 10 years ago the number 1 risk factor for breaking your wrist, I probably would have said skiing, skateboarding, or some other similar impact activity. But what has absolutely blown the competition out of the water year in and year out is the apparently diabolical combination of walking your dog when it's icy. You wouldn't believe the number of times I hear this story. If it weren't such a bummer for these patients, it would be borderline comical. Now, to be clear, ice is just the cherry on top. I don't know if it's because there's been a recent surge in dog ownership or what, but I see an absurd number of injuries from walking the dog. Wrapped leashes, sprain and break fingers, dogs lunge and pull their owners to the ground, And don't even get me started on the hand injuries from dog bites. I love my Fido just as much as the next person, but if you have dogs, are around dogs, or take care of dogs, I want you to be on alert with these lovable but unpredictable beings. And if you're going to walk your dog in icy conditions, may the force be with you. Number 4 is speed and impact sports. This one I probably don't need to spell out, as it's pretty obvious, right? Whether it's some sort of speed sport or contact sport, you can imagine that hands, wrists, and elbows get broken frequently. Just imagine the impacts and mishaps that are bound to happen with skiing, snowboarding, skateboarding, mountain biking, e-biking, motocross, scooters, etc. And of course, athletics like football, lacrosse, hockey, boxing, you get the point. I will say that skateboarders seem to have it particularly bad within this cohort. I imagine it has to do with the fact that they land on cement when they crash. Their predilection for specifically getting what I would consider the worst type of wrist fracture, a scaphoid fracture, is always surprising to me. Like a Pavlovian dog, when I see skateboard injury on my clinic schedule, I immediately start planning how to treat their scaphoid fracture. So some takeaways from today. Increase your awareness around specific, high-risk daily activities, and you're likely to eliminate the vast majority of potential hand injuries in your day-to-day life. It turns out, sharp tools really are dangerous to the hand. I see this most frequently with table saw injuries and kitchen accidents. And also of no surprise to anyone, impact and speed sports put us at high risk of wrist and hand injuries. What may surprise you, though, is how risky it is to walk your dog, especially in winter. The whole point of the Pareto Principle is recognizing the unbelievable amount of work it would take to get 100% out of anything. Call it diminishing returns, call it marginal utility, call it getting an A is just fine, I don't need the A+. Sometimes that extra squeeze is worth it, but in the case of injury, we all know there's no realistic way to keep ourselves completely safe, unless you're ready to live in a bubble. So instead, make the most out of your effort and incorporate these few tips in your life to keep yourself out of most hand injury danger. That's all for today. Thanks for being here. See you next time.